We're currently at Kingston Powerful, currently in the construction phase. We landed the modules approximately 4 to 5 weeks ago, and we're currently starting the internal fit out.
It's fantastic to show our clients from NHS Property Services, from the Integrated Care Board and Queen Elizabeth Hospital NHS Trust around the building as it's really starting to come together. You can still see various elements of the building process. So the passive purple on the roof, all of the internal walls are now in, and mechanical and electrical services first fit is starting up at first floor level. All partitions are in throughout the building, and it's a really great point to show the client around what will ultimately be their finished article.
The response from everyone walking around today has gone down really well. It's nice to show people that are not construction minded, the ins and outs of the construction phase and the amount of work that's involved in getting this project to hand over.
Health Hub in Kings Lynn is really important to local patients to make certain they get the right care, the right place at the right time. Being integrated with the Queen Elizabeth and primary care means that there's more opportunities for those interactions to happen. It's also the once in a generational opportunity here with this site, another development to the north of the town. It makes it quite an exciting time for residents of Kings Lynn.
The facilities that are going to be delivered here, such as social prescribing, physio and the maternity services, will mean that people don't necessarily have to go to a GP to have health needs identified, and for many people that's going to be a welcome relief.
To have somewhere that's purpose-built for us that we can just move straight into and start working from, to have more access for women to make it easier for them so they don't have to go through the parking at the hospital or the transport links, will make it a much better experience for them. It's really exciting to see that it's actually now into fruition and there is an end in sight and we could be moving in here soon.
At Darwin Group, we utilise modern methods of construction to create a passive first approach. We optimise thermal insulation of our buildings. We optimise air tightness, and that's all done in a factory environment where we can control the quality. So the sustainability measures we have installed on this building ensure that we can achieve net zero carbon in operation. That means that the building uses less energy than it generates, and any extra generated energy can go back to the grid, and essentially reducing the trust energy bills.
This has been a project on paper only, so to actually be able to come around, to have a tour, to see the development of the building and to see some of the things that we were introduced to in the PowerPoint presentation actually on the roof, the purple lining that is going to make this building airtight and so impact significantly on the carbon reduction that our council is looking to do is really, really exciting.
The design team were really responsive and listened to customer feedback and were able to turn around any modifications pretty quickly.
And it looks as if it's been really well thought out, and the people, the clinicians that are going to be delivering services here, I think there's going to be fighting for space.
Darwin Group find collaboration with all stakeholders across projects of critical importance. Ultimately, we understand that our buildings deliver fantastic facilities for the local community. We've worked really, really closely with stakeholders at NHS Property Services, the Integrated Care Board and Queen Elizabeth Hospital's NHS Trust to ensure that we give them the best possible building we can, which will drive the best levels of patient care.
It's really impressive. Things have happened a lot faster than I expected. I wasn't expecting to see plaster on the walls. The building's a lot bigger than when you compare to a floor plan, so it's really great. It's going to be a good facility, and I like the purple. I think we should stick with purple.